Okay, so welcome everybody to today's workshop on making treatment decisions. This is a super important topic, and we are lucky today to have a couple of staff members from SSM Health to help us out with this workshop. I'm going to go ahead and start by sharing our screen. Today's workshop, and thank you everybody for being here, and I hope you do enjoy the workshop. And I'm going to go ahead and change. All right, Jody.
Okay, well, thank you for having us. My name is Jody Davis. I'm an RN BSN. My title at SSM is a oncology nurse navigator, and we'll be covering today treatment planning, how to choose your treatment team, setting goals, guidelines and pathways, treatment options, caregiving, and questions and answers at the end. Sarah Mistretta is also here, and she will be covering like the second half of the slides.
Yeah, so I'll just introduce myself as well. I am Sarah Mistretta, and I'm a nurse practitioner at SSM in their medical oncology department. And so, like Jody said, I'll be covering the second half of the presentation, talking about treatment options and guidelines and that sort of thing. So happy to be here.
All right, so bear with me, I'm kind of challenged here. I'm not sure how to get these slides to change. I'm sorry, Kirsten.
So I'm changing the slides on my end. So you could just say, you know.
Oh, sure. Next. Sorry. Okay, so this program was developed by the cancer support community, developed content independently, and then had outside medical and psychosocial experts review it. Cancer support community has final control over the content. Program was generously sponsored by the Foundation Medicine Incorporated, and presenter was engaged by Gilda's Club. All right, and Sarah and I we have no financial relationship or affiliation. We're not being paid to do this, something we volunteered to do. So basically the objectives of this is we want people to learn how to recognize what their treatment needs are and how to go about getting that. We want people to learn how to get information about their diagnosis and what treatment options are available, how to build the support system. We want to educate patients on how to ask questions and advocate for what you need. And then we're going to give information for caregivers and making decisions, and then what choices are the right choices for you. So basically we want patients to learn how to educate themselves by learning about your diagnosis, learning what you need to know. Just because you've been diagnosed doesn't mean that cancer is who you are. It means that's part of who you are. We want you to be able to get the support you need, and we want all of our patients to have hope and courage with being able to deal with their diagnoses. Some of the treatment options, when we get a patient that's newly diagnosed, we try to schedule them. We have specific providers that deal with specific diagnoses in Madison. When they go to the outreach clinics, they deal with all the diagnoses, but things that affect what treatment you're going to get include your age, like where you're at in your life, your work situation, your family situation, your overall health, and how many other health issues you may have. We also want to know what your expectations are from treatment. And costs, we always check, our facility always checks the cost to make sure insurance is going to cover it. We help with transportation needs. We want you to know what available resources there are for you. And we try to answer all of your questions at your initial consultation appointment. So things that you should think about as a patient are setting your goals. What's your biggest goal? Like, do you want to be able to continue working? Do you want to, do you want to pursue treatment? All those things are things that you need to think about. We want you to plan a strategy, find resources that are available for you. That's something that we can help with also. Gilda's Club, I know, can help with. Ask for help. Don't ever do it alone. Make sure that you're engaging people that are offering to help. Take advantage of it. So with treatment decisions, we want it to be a shared decision. We want you to work closely with your provider, the nurses, the whole team, to be like, okay, this is the direction we want to go with treatment. This is what we're looking for. That's called shared decision making. That is relationship based. You and the healthcare team discuss what treatments are available to you, what's the most important to you, what your goals are, what's your current living situation, so you can reach a mutual agreement on what your treatment goals will be. So setting your goals would include things like physical, emotional, and sexual health. Like, what's most important for you to be able to do? Do you want to keep working? Do you want to just be able to have enough energy to play with the grandkids? Do you, that kind of thing. Family and social, like, what's going on in your lives that's important to you? What types of things are your goals to get to? Work, school, home. Again, do you want to or need to continue working? Is your schedule flexible? What are your goals as far as being able to care for yourself at home, staying at home? Just those kinds of things we want you to take into consideration when you're looking at treatments. And then community involvement. Are you getting the support you need? There's so many support groups out there. Gilda's Club is a big one that we refer patients to. So we want to make sure that you're getting the support from people that understand. Also with personal and spiritual, are you a person that's part of a religious community or some type of spiritual community that's there to help you? And what other things are important to you? So it's important for you to think about your values and what matters to you. For example, I value being active with my family. I value being healthy and to attend graduation, a wedding, an anniversary party. Side effects, that you want the best treatment no matter what you deal with. All those things are important for you to think about. What matters to you the most? So cancer, it is a journey. I know people say that, but it really is. There's many decisions that you need to make along the way. You want to take things into smaller pieces. Think about right this moment, like, what are your goals right now? It may change in a month from now. It may change in 2 months from now, but you need to kind of look at what's going to work for you. Come up with that with your doctor. What's the best treatment plan that you guys can come up with that not only addresses your long-term goals, but your now goals? As far as understanding your diagnosis, obviously you want to ask your doctor what kind of cancer you have. Write it down. Bring somebody with you. That extra set of ears never hurts. If you don't fully understand it, please ask questions. That is the job of the oncology staff, is to answer those questions. You can request a copy of your test results. If you have my chart for SSM or UW, you can view them on there. Most of the test results will give you, like for labs, what is normal and where you're at. Ask the doctor ask the doctor what they base their treatment recommendations on. Ask the nurses. The nursing staff are invaluable to you guys. Talk with other people who've had cancer. just understand that each type of cancer, even if it's like a breast cancer, every type of breast cancer is different. Every person's different. So it's never going to be exactly the same as someone else. So staging, that's a big thing that we talk about in oncology. A lot of times we'll do scans to stage the cancer. That means if it's localized to that one area, has it spread to other areas? If it's spread to numerous areas, then the staging is more than if it's right in that one area. Symptoms of cancer, it kind of depends on the cancer. That will also depend on the treatment. And there's always an appointment with people like Sarah, who will be speaking in a little bit, and they go over the side effects of the different types of chemo that someone will be getting. Testing depends on the diagnosis. Almost always you'll have lab tests. If not before every treatment, you'll have lab tests, probably monthly, to make sure your lab values are staying within a normal. You can get a second opinion wherever your insurance covers it. If you want to get a second opinion, none of our doctors would be offended by that. They would be all for it. Get a second opinion. You need to get all your options available. So your doctor and cancer center do depend on many factors: cancer type and stage, your personal preference, insurance coverage, and logistics like transportation, distance, and cost. As far as SSM, we have outreach clinics in Dodgeville, Sauk, Baraboo, not Portage anymore, Beaver Dam, Columbus, Fort Atkinson, and Janesville. So we service the outreach areas where people don't want to come to Madison. If you are eligible for a study, we have studies available, but also UW, if it's such a thing that we don't deal with, we'll refer you to the UW. We don't have a problem with that. Just know that there are options available. Feel free to ask your doctor, because every one of them are open to that option. So possible members of the healthcare team, medical oncology is what Sarah and I work. What that means is we deal with like the chemotherapy portion of it. We don't do surgery. We don't do radiation. We do the chemotherapy end of it, and it's medical appointments. Advanced practice provider is Sarah's position, and they see patients. We have the nurses that administer chemo. We have surgeons within SSM and UW that do specific types of cancer, surgeries for specific types of cancers. Pathologist is the one that reads the biopsies. Radiation oncology for SSM, it's Turville Bay, but there is one at UW also. We have a social worker on site. So there's so many different people involved. We all are in touch with each other so that things don't get dropped. We also, as far as our facility, we have a pharmacy on site. They don't dispense medications, but they mix up our chemo for us. We do have an oncology psychologist. There's registered dietitians that you can be referred to. We have plastic surgeons within the system, home health, hospice. We work very closely with all of those organizations. I always tell my patients, write down your questions before you go to the doctor. Bring them with your appointment. You can discuss it with them at that time. Make sure if you're going to record the visit, you just double check with the doctor. Usually it's not an issue. I always say an extra set of ears doesn't hurt. Currently with the COVID, we're allowing one person with you, one adult. However, we have phones in all the exam rooms, so you can put two people on speakerphone to listen in if you want. Make sure you keep us updated on all the medications you're taking, including vitamins and supplements, because that way we know if anything we're going to prescribe will interact with those. Staying focused on what's happening now rather than what may come is a biggie, because it's why worry about what may happen. Let's stay in the here and now type of thing. We have people in our financial area that help people to discuss coverage of medications, that kind of thing. If you need that kind of help, let staff know. If you're struggling, let us know, because we really, really want to help. We don't want you to feel like you're out there all by yourself. And I'm going to turn it over to Sarah.
Thanks so much for that, Jody. That was a really great summary, and you had a lot of awesome points, very important points. Especially the questions at the beginning, I felt like a lot of those questions about goals of care are really good to bring along to your appointment. And I think I'm taking some good notes too about some things that I should be asking patients, and just to make sure we're delivering really comprehensive holistic care throughout a cancer diagnosis and treatment. So again, I'm Sarah, and I'm one of the nurse practitioners at SSM Health in their medical oncology department. And I work with patients that are going through medical cancer treatments who may also be going through other treatments such as surgery and radiation. And so I'll be covering different treatment options and different things to know about. So next slide. So some things to discuss with your doctor when making a treatment decision are everything that Jody had described, the goals of the treatment. You want to be very specific and have a really good idea. Is this cancer treatment curative? Is this cancer treatment palliative, meaning to prolong life? And to hear that answer directly from your oncologist is important. We want to know, what are the benefits of the treatment? What types of treatment are you getting? Is this going to be chemotherapy, immunotherapy, surgery, radiation? And what are the side effects that you would experience with each of those types of treatments? And you also want to know, why is the oncologist choosing the treatment that they are? Another important consideration is cost. There are some cancer treatments that have been around for years that are well covered. Insurances have no problem covering them. And then there are some cancer treatments that are newer, and insurance companies haven't fully covered yet. So then we explore other options for coverage, but sometimes it ends up being a little bit larger out-of-pocket costs for patients. So that's important to know and to discuss with your healthcare team. Also, just with the last slide too, it's important, kind of what Jody had talked about, but there are some hidden costs of cancer treatment. Is that the transportation costs? Is that costs for different nutritional therapies, all sorts of different things. So just getting a comprehensive idea from your healthcare team. And so there's a difference between guidelines versus pathways. There's a focus on developing evidence-based standards of cancer care, and you really using studies to drive what treatment we're recommending for patients. This helps doctors and patients make informed treatment decisions. And there's two basic approaches to developing the standards that are called guidelines and pathways. Guidelines are based on a specific subtype, genomic profile, and stage of cancer. Panels consisting of cancer specialists, experts in psychosocial care, and patients help make these guidelines. And they're developed based on what is known to work best for treatment, and the costs of treatment don't necessarily impact the recommendations or the guidelines. Pathways are shown to improve quality of care by ensuring that patients receive the most proven therapies rather than unproven and expensive ones. They're a formula for making and paying treatment for treatment decisions, and they include preferred drug choices. And in some cases, oncologists receive financial incentives for adhering to the pathways. And some questions to ask about treatment options when going over, different options. There's always more than one option when going into cancer treatment. So it's important to know what those options are, risks, benefits, and some questions that you can write down and bring to your appointment, ready to ask your healthcare provider is, what is the goal of this treatment? Why are you recommending this treatment? What are the risks and benefits? And how can we prepare and manage for the potential side effects? Questions, so more questions to ask about would be, how often will treatment be given and where? Will the treatment be given every day for 5 days in a row? Will it be given once a week, every 3 weeks? It's important to know because a lot of medical cancer treatments have many different schedules, and especially for chemotherapy treatments, we talk in terms of cycles and days, and it gets kind of confusing, this lingo we use. And so clarifying that with your healthcare team and making sure you really know how often you're supposed to be in clinic is important. And then also how long the treatment will take. Some treatments take an hour, and some take 8 hours of your day. And so it's important to have that information so you know what to be prepared for. There's also different forms of treatment. Some are an IV infusion, and that goes into like an IV line in your arm. Some are infusions that we recommend having a port placed for. Some are a pill that you take at home. How long? We already covered how long does each treatment last. And then also, does the facility where treatment will be given also offer resources for emotional support? That's important. So there are different treatment options for patients with different cancer diagnoses. And there are a lot of new treatments coming out. So each day it seems like there's new treatments being added to the list of available treatment options. But these include chemotherapy, radiation therapy, surgery, targeted therapy, and immunotherapy. I think that when patients, and just I guess the general public, when they hear about a cancer diagnosis, their mind goes straight to chemotherapy, sometimes radiation. But you know, all of these areas are treatments that cancer patients may expect to go through. The ones that are in the news most often are targeted therapy and immunotherapy. There's a lot of research coming out about new treatments in those categories. So we'll discuss kind of information about each of those categories. So chemotherapy, what is it? It's a treatment that involves the use of drugs to destroy cancer cells. So it can be given through an IV, a pill, injection, or directly to the tumor. It really depends. There's a lot of factors that we use to decide what chemotherapy is given and in what form it's given. And so just because, you know, chemotherapy can be given in a pill form doesn't necessarily mean that'll be the type of chemotherapy that is recommended. So it's important to know what form the treatments will be. And then chemotherapy is also called a systemic therapy, meaning that it targets cancer cells kind of anywhere in the body, whereas surgery could potentially be like a localized, and it's just focused on that, on a mass, for example, whereas chemotherapy affects cells kind of throughout the body. Radiation therapy, there's different forms. External radiation is delivered by a machine aiming high energy rays at a specific body area. And these treatments are usually done once a day for several weeks. I think something that I hear a lot of people say, and I'm not a radiation therapy nurse practitioner, but something I hear patients say is they were surprised by how quick radiation is. Sometimes that first appointment can take a little bit longer, but then thereafter radiation treatments can typically be, you know, a brief appointment, and they don't generally take hours or all day like sometimes the chemotherapy appointments can take. And then there's internal radiation. This is where a radiation source, such as a seed or a capsule, is placed inside the body. And it may occur until the body no longer gives off radiation at a high level. So sometimes patients have to be admitted for that. Surgery is the most common form of cancer treatment, and it can be used by itself or in other combinations with radiation or chemotherapy. It also can be used to help determine what type of cancer you have. So what would happen in this case is the surgeon would take a portion of the cancer, the tumor, and send it to our pathology department and look at it under a microscope and really get to the bottom of what cancer is this. Sometimes we don't always know that based on a CT scan or other imaging. Staging, so it can determine how the cancer has developed and what stage is it. Is it found in the lymph nodes? Is it found in another area of the body? It can also be helpful in treating the cancer and trying to stop this cancer spread. And so if we can kind of take out a tumor in that way, we hope that we can get the full tumor so that it doesn't spread to other areas of the body. And then debulking can also be helpful with surgery. So that just means that taking part of the tumor out, that maybe it can't be fully removed, but it can decrease the amount of tumor in the body. And then reconstruction. So this sometimes cancer or cancer treatments can impact the appearance or the function of the body. And so reconstruction surgery is also a fairly common type of surgery. And then targeted therapies. So these are some of the treatments that are a lot of research is going into. So these targeted therapies precisely attack cancer cells by targeting a specific gene or protein. So they're very specific to a patient's type of cancer. They can be given also through IV, pill, or injection. And not all types of cancers can be treated with targeted therapy. Immunotherapy is also a type of cancer treatment that it works very differently than a type of chemotherapy. So it uses your body's immune system to kind of identify, attack, and kill the cancer cells. So sometimes our own immune systems kind of become almost blind to seeing a cancer cell, and our own natural defenses aren't working in the way of getting rid of the cancer. And so this immunotherapy helps our own body see this cancer and trying to decrease it. And these immunotherapies are usually in the form of an IV therapy. There's also palliative and supportive care. So palliative care, the purpose of this is to really provide patients with relief and symptom management from cancer-associated symptoms, pain, and stress. And palliative care can start day one of a diagnosis, and the goal is to improve quality of life. It also really focuses on a holistic patient perspective. So sometimes in oncology, we really zoom into looking at this cancer and how do we treat it, and what's the best thing to do for this cancer. And oncology care really is looking at this whole person, and what is good quality of life for this patient, and how can we allow this patient to have good quality of life, and palliative care really helps in that. I think that sometimes in oncology visits, there's, each patient has only so much time to spend with the oncologist. And so sometimes certain things like nausea are addressed, but then other things like, pain, aren't cared for as well. And so the palliative care providers can offer support even the same day and see that patient the same day to follow up and make sure, how can we best control your pain and that sort of thing. So it's really we focus and function as a team together. And it's some common misconception is that palliative care is associated with hospice care, meaning end of life care. But really in most facilities, palliative care is different, and it's symptom management and not end of life care. There's overlap, but it's not the goal of palliative care. Patients can receive palliative care and cancer treatment at the same time, whereas hospice care is typically no more life sustaining treatments and focusing on end of life. So questions to ask during treatment. The symptoms and side effects that are affecting me the most are, these are interfering with my life in the following ways. What can we do to manage these symptoms? Could complementary therapies or palliative care help me manage my symptoms and side effects? Can you refer me to a palliative care specialist? And then coping with side effects. So sometimes patients have more side effects than others just based on the type of treatment they're going through. So it's good to write down almost like a journal sometimes of what your side effects are, because in some situations, patients are seen like every 3 weeks in between their chemotherapy or immunotherapy or whatever therapy treatments. And so you go 3 weeks without seeing your providers, and then you kind of forget what happened 2 weeks ago. So if you track your side effects, you can sort of readdress that in your office visits with your oncology providers, and we can help manage and figure out how to best manage these side effects. You can write them down at the time, severity, and what were you feeling? How did they impact your quality of life? And make sure to, of course, talk to your team about your side effects. I think it's very important to stress that point, because sometimes patients will not bring up certain side effects in fear that maybe they won't get treatment that day. And it's always really, it's good not to hide anything from your providers, so that way we can make sure we're giving you the best, safest care and managing your side effects as best as possible. So there are some tools to help with common concerns or certain important documents that everyone can ask their healthcare team about. So a living will or an advance directive allows the doctor to know what kind of medical care you'd want if you can't speak for yourself. And a durable power of attorney names a person who will make healthcare decisions for you if you're unable to make them yourself. This person is called a healthcare proxy, and it does not need to be an attorney. I think that these types of documents are important to discuss with your healthcare team. And if you're, sometimes these topics can be hard to bring up with your healthcare team. You could bring them up with anyone, a nurse, a social worker, your oncologist, the front desk. So anyone really, we can help get you to the right resources for these things. And then there are some tools to help with these concerns, including a financial power of attorney. It names a person who will make financial decisions for your home and medical care in the event you're unable to do so yourself. A do not resuscitate, DNR, or allow natural death, A&D, or do not attempt resuscitation, DNAR order, is an order for your doctor if you would not like heroic measures to be taken in the event of cardiac or respiratory arrest. And a will states who will receive your money and belongings and who will be responsible for your children in the absence of another parent. So there's a lot of technical jargon with those types of important documents. I would recommend, if you're uncertain about where to start with that, is get the name of the social worker that's in your healthcare team. And the social worker is a really great resource in asking questions about those types of documents too. Caregiving. So while you may feel rushed to make a decision about your loved one's treatment, it's important to remember to slow down and think things through. This will give you a greater sense of control and provide a calm presence. Take time to ask questions, think through the steps, and partner with the medical team to develop a treatment plan for your loved one. It's important to know that to take notes for yourself and your loved one, and compare notes after each appointment to discuss what each other heard. You may interpret things differently, or one of you may have missed something. Make time to care for yourself and ask for help when you need it. That's really important. So, cancer treatment, if there is a caregiver involved, having that person along taking notes, like I had mentioned, can be helpful, because it is hard to process. There's so much information thrown at a family as this is going on. And so it's important that, the oncology team is of course there for patients going through cancer treatment, but also the family. So the family should never hesitate to reach out and ask for help if they need it as well. And we can set you up with the right supports. So taking the next steps. Be selective as to where you find your information. Use proven, reliable sources. And if you're not sure what makes a resource reliable or not, don't hesitate to ask. Benefit from the experience of others, but remember that your path is unique. That's very important. We covered all the different types of treatments, and there's so many different cancers. And like Jody said, for example, breast cancer, there's just so many different factors, and you can't just say breast cancer and everyone has the same experience. It's just very unique. And choose a doctor that you can trust and feel comfortable openly communicating with. I can't stress that enough. If you feel like, you had your initial appointment, or maybe you've had several appointments with your oncologist, but you just don't feel like that provider is listening to your goals or your needs or communicating effectively with you, don't hesitate to ask for a second opinion. And that could be even within the same healthcare system. The goal is really, it's your care, you're the most important thing, and there will be no hard feelings at all in our healthcare world if you need a second opinion. So don't hesitate to advocate for yourself. And if you feel like you have to talk with, nurse practitioner or nurse, social worker to help support you in that, that's what we're here for. Cancer community support resources. So these are some great options. There's the Cancer Support Helpline with the number there, the Cancer Experience Registry. This is a community of people that have experienced cancer, and they collect and analyze data about different healthcare journeys. And then Open to Options is another research proven program that can help prepare lists of questions to discuss with your healthcare team. And then Frankly Speaking About Cancer is an educational series that has evidence-based information for patients and families.
Which is actually what this workshop is a cancer, it's a Frankly Speaking About Cancer. So just to go back a little bit with the Cancer Experience Registry, it's a survey that has been collecting data for about the last 12 years, and they've been doing updates, and it is one of the few patient and caregiver resourced research programs that is out there, and it's a longitudinal thing. It's easy to participate in, and if you want to do something that can give back immediately, a lot of times people are like, oh, I want to do something to help. It's like, that's actually something you can do to give, your real lived experience. And Open to Options is a program that There are 4 of us on our staff that have been trained to do this workshop, or to do this meeting. So really great resources that are a part of the Gilda's Club toolbox. Oh, there we go. Another thing that might be really great to know about is my Lifeline. And my Lifeline has, it's sort of like caring bridge with tons of bells and whistles. It provides interactive blogging and update programs so that you can keep everybody updated. And they send out your thing to all of your folks. It's got a help calendar. You know how we were talking, Sarah was talking about asking for help, and Jody was talking about, you know, people want to help, and sometimes asking for help is so hard because you ask the wrong person for the wrong thing at the wrong time, and then you feel all deflated and you're like, ah, forget it, I'll just do it myself. You don't need to do that. This helps you coordinate your volunteers, your people, your team with meals and rides and errands and childcare and pet care and mowing the lawn and all kinds of stuff. Whatever you need help with. I actually know somebody who crowdsourced her friends to paint her apartment because after her cancer diagnosis, she had a bike accident and broke her arm and wasn't able to paint her apartment when she needed to. Got her people like in 2 days. Discussion boards that are a lot of specific cancer types. Care coordinators, you've got one person who sort of helps with all of those assignments of help, and then it's all really well controlled and very private, and goes just to your folks. So with that, we've got questions. I'm going to stop the share, and I'm also going to stop the recording.